Hello friends, I'm Dr. Sanaullah Hansali, and in this video we'll be discussing the steps to remember before and after any examination. These are the necessary steps, and before starting examination you will follow some steps, and this is much necessary and you will have to follow it. And I will tell you some mnemonics to remember this, but everything, all will be remember after practicing a lot on patient, on your colleagues. Okay, so starting from the before, I'll remember the mnemonic is there. Why per. We'll follow this mnemonic. Now coming towards why, what does it mean? W I P E R. W stands for wash your hands. Before touching a patient, you should wash your hands. This is the necessary one. Second one is introduction. Brief introduction, like you can say, I'm Dr. Sanaullah Khan and I'm a resident surgeon. Can I confirm your name and age, please? So it is self introduction and patient introduction. Patient, you should ask about name and the age of the patient to confirm if this is the one I'm going to examine the patient. Third one is P. P stands for permission. Okay, so permission means consent. You should take consent about the examination, but this should be informed consent. You should inform the patient that I will be examining your neck, in which I will be first try to see by neck, by eye, and after that I will be touching it, and at the end I may need to auscultate the neck. So you should take informed consent from the patient. E stands for exposure. Proper exposure of the patient is important. Like if you are examining the neck, you should ask the patient, try to unbutton the upper button of the collar so that I can see it properly. At the end is repositioning. Position of the patient is important. So this is general steps you should follow before touching a patient for any examination. Write it with yourself, and after trying to touch the patient, you should follow all these. First, wash your hands. Second one, introduction. Third one is permission. Fourth one is exposure, and fifth one is repositioning. After all this, you should start examination. Now you have done examination and all the teaching stuff. After when you complete the examination, then another one is to happily, this is mnemonic, okay, wave safe drives. You can make it mnemonics for yourself, which will fit for you, which you can remember. T stands for thanks the patient. This is really important. Now you have already unbuttoned the upper button of the collar, so the another one is H, help patient dress. Now coming towards the wave, another one. This is again W, and W stands for wash your hand. After completing your examination, you should wash your hands. Before examining, you should have sanitizer with you, and after that you should wash your hand with sanitizer or any soap nearby. S for summary. And this is the step in which you will tell the patient that I have examined your neck and there was a lump in the anterior triangle, or we must say in the front of the neck, which was most probably it could be due to thyroid enlargement or thing like that. You should summarize the patient in simple words. And at the end is drive. You can tell that my differential diagnosis is that it could be due to thyroid. This is differential diagnosis. Okay, so you can also THWSD. You can also do all this with you. THWSD. if you can remember these words, this is also important. This is also, you can do it. And this is all the steps. These are all the steps which I have told you, and these are before and after examining the patient. Okay, now we, in this video series, we will do will be discussing all the examinations stepwise, and you should write it with yourself, and after writing it, you remember it and try to practice in a patient and your colleagues in your mat. As this will just, this is just I'm telling you the steps, you will follow it, and definitely you will try to practice on patient as well. But for you to remember all this, you should practice by yourself, and this is important. You can practice on your roommate, on your colleagues, anyone, and definitely if you find a patient, it will be really important if you will follow the steps. Okay, thank you so much for watching our video, and kindly subscribe our channel Medical Online. Thanks for watching.